Hello, my name is Andrew Gorecki. I am a physical therapist at Superior Physical Therapy, and I'm here today to talk to you about lumbar disc herniations. I'm going to try to show you what I would consider the top 3 exercises or movements to help treat or to help relieve the symptoms of a disc herniation. Now, keep in mind, there are lots of causes of disc herniation, and sometimes they require surgery, but oftentimes, in fact, 80% of the time, we know that within 6 months of conservative management through physical therapy, that 80% of the time people are able to avoid surgery. Now, as a personal story, I actually did have lumbar surgery, and interestingly enough, after the surgery, my disc herniation came back. And so I was able to, for a second round, relieve the disc herniation through physical therapy, which is part of my story on why I'm a physical therapist today. But I'm here to tell you that surgery is not always the answer, and I can speak personally from that experience. And if I told you there was a natural way to fix yourself that required no injections, no surgery, and no medication, that's what we're talking about today, is the top 3 strategies on what we see in the clinic that is common movement limitations for a disc herniation. Now, there's 2 main areas that we see that are limited in people that cause the disc herniation in the first place. The number one is hip mobility issues. If somebody doesn't have proper hip mobility, that causes a lot of stress on the disc and can actually tear that disc, which is where that disc herniation comes from in the first place. The second most common area is the upper spine. If we're moving in our day and our upper spine is tight, that's again another area that causes more stress on the disc and can be the dysfunction that causes the symptom of a disc herniation. So let's talk about the hips first. By far the most common hip limitation is the front or the anterior part of the hips, a muscle called the hip flexor. I'm going to show you a very easy strategy on how to get that muscle to loosen up and take pressure off your disc. We're going to get into a position here where we have one knee on the ground. This foot's nice and in front. I know this muscle has to be able to lengthen in 3 planes of motion. So the first plane of motion is front to back. So I'm going to get into this position here where right away I start to feel a little tension in my hip. My back's not hurting. I'm gently moving my hips front to back. I'm going to try this for 30 seconds. Then I'm going to try side to side, which is our second plane of motion. And I'm just going to gently let my hands move. Now, if this is hurting my back, I might just try to let my hips move. 30 seconds. And the third motion is going to be rotation left and right. So after a minute and a half, I'm going to switch my legs. I'm going to go through the same sequence, front to back, side to side, rotation right and left. Okay. Now, the second most common area is going to be limitations in the upper body, upper back. So I'm going to show you a strategy how we're going to use this wall, and we're going to actually take a strategy that tries to relieve pressure from the nerve that the disc is pushing on. And so we know that pressure relief is going to come from motions that create left side bending, if my right side, right rotation, and flexion. So we're going to try that using this wall. So what I'm going to do here, I'm going to put my left foot forward and my right foot back. I'm going to put my hands to the right side here, which creates that rotation. And then I'm just going to gently let my left leg go forward and back. Now, as I'm doing this, I should feel tension in my upper spine, not my lower spine. I'm going to try 60 seconds. Now, that is for somebody who has right-sided disc herniation. If I have a left-sided disc herniation, I'm going to switch. So I'll put my right foot forward, my hands to the left, and essentially just go and try the same thing over here. Now keep in mind, that's important. It's right side versus left side. Don't do that on both sides if only your right side is hurting. So that's number 2. And finally, number 3, disc herniation movement that I'm going to show you is how to loosen up the inner thigh. Very common for people that are spending time sitting to have limitations. We're going to take the left foot and go this way, right foot and go this way. Gently drive the hips towards the elevated surface for 30 seconds, then front to back, and then we're going to go around in circles. Each one of those is 30 seconds. This is going to provide you with a lot of hip mobility, which should take away stress from the disc herniation and allow the body to heal itself. That's the key here, is creating an environment so that the body can heal, which it does very well when given the right opportunity. So if you want to have a natural healing process without surgeries injections, and medications. Try these 3 exercises, but keep in mind, there are hundreds of reasons why somebody had a disc herniation. It would be very wise to get a personalized one-on-one assessment from your physical therapist to determine your limitations, but this is a start, and if it doesn't work for you, I would give this 2 weeks. If it doesn't work for you, don't give up hope. Don't get discouraged. I would encourage you to come in and talk to us. Schedule an appointment today, 231-944-6541. Thank you.